Mr. Dubé, does your government have a credibility issue with teachers? We're looking today at a few hundred, about 420 teachers just in the Pearson School Board who do not want to go back to school because they're concerned about the measures. Obviously, one of them being students not wearing masks in class. How do you convince teachers that the measures you're adopting are safe, and do you have a credibility issue?
Well, we have 100,000 teachers. You're talking about 400. Okay, so first. Second, I think we need to prove over the next few days, which are starting now, that our measure will work. But I think, we cannot do that by ourselves. It's a teamwork. So it's just normal. We had the same issue with nurses and personnel in health that were nervous, and we were in a more difficult situation 6 months ago than the way we are prepared. So if you ask me, is it normal that 400 teachers on a group of 100,000 that could be nervous and are asking questions? I think this is normal, and we sense that. But I think that we've seen a lot of innovation by those teachers, as we've seen with the nurses. I've been around hospitals in the last 2 months, and what I've seen, the creation of putting duct tape on some walls, and we are at war. So I think we need to understand from where we start. And that we had hospitals that were still in bad shape, but people have been able to do miracle with that. And I think that's the same thing with school. If you ask me, we know that from start, that our school, 54% of them are in bad shape. We know that for the last 2 years, and we have been investing in schools. So we're asking the teachers, well, we understand that, but those kids need to be in school. They need to have socialization. They need to learn. So we're just asking, and this is what Jean-François Robert is spending his time, is making sure that we reassure them. I'm crossing fingers that, the first week is like any new thing. The first week will go by, we'll see, we'll readjust, but let's give us a chance. I think we're working really hard to be ready.
Okay.
Next
Mr. Arruda, do you have
question,
any assurances to give to teachers who are maybe concerned about the measures that you've
I
adopted?
understand their concerns, but they will get access to, if they cannot be at 2 meters from the student in specific kinds of classes where there's young kids, or if there is handicaps on them, they could have the protection that is going to be offered as other work. The society is working in a different way. It's not going to be the same school as it was before, but the measures that are there are going to be protecting them, I think, if they apply it. And I think that they can protect themselves by being at 2 meters from others. And I think that we prove that, I would say, in different settings, as the minister says, there's going to be even a risk of outbreaks in school, because kids and even the teachers can be infected in their own family. It's a waste. So, but I think what is more important is the distanciation, 2 meters, wear a mask if you cannot respect it, wash your hand, and I will say that the system that have been put in places in class, the bubbles that are going to be able to investigate rapidly will be, and the ones who are at very high risk, they can be not working, and they're going to be teaching in distance for kids.
I know yesterday there was a joint letter from a group of doctors issuing some recommendations about back to school. Are you considering applying any of their recommendations?
Well, Dr. Arruda has answered. I think the fact that we have discussed a lot with experts over the last few weeks on that, our plan is solid. We'll look at, we're always open to suggestion, but I think at this time right now we have a clear plan. We have a way to go with schools. We'll go this way. And if we need to adjust, as we've done in the last 6 months, we'll adjust. But right now, that's the plan that we have.